Good evening, doctor. This is Nurse Saskia from the ER.
Okay. Yes, Nurse Saskia, I'm listening. Go ahead. What's going on?
Sorry you bother you. I need to report a burn patient with a possible airway problem that need urgent evaluation. Alright. Alert doctor, I'm reporting a patient, Mr. Hendra, 35 years old, admitted to ER 10 minutes ago after being rescued from a house fire approximately 20 minutes before admission. He was trapped in a closed, smoke-filled room for several minutes before rescue. Assessing this patient as emergency case, doctor, because I suspect an inhalation injury alongside his burn. Okay, for history, doctor, the patient has no chronic illness and no drug allergic. Sign admission. I've applied amplified oxygen rebreathing mask at 50 liters per minute. Inserted two large bore IV illness with ranges later running according to the burn recursion formula. Covered the burn area with clean dry dressing and keep him warm. For my assessment, pending doctor, I go through the point by point. For airway, I think risk signed nasal high note, short around the mouth, and not least, hoarse voice audible stridor. For breathing, respiratory rate 13 breaths per minute, oxygen saturation 19% on 15 liter non-rebreathing mask, carbonaceous sputum when gowning. For circulation, blood pressure 100 over 16.5 millimeter of mercury, pulse and 128 per minute, extremities warm, capillary refill under 2 seconds. For disability, BGS 15A 4V5 and 6. Patient alright but anxious and restless. For exposure, temperature 13.7.2, dangerous Celsius, ventral thickness, burn estimated at 25% to total body surface area involving the anterior chest, both arm and face. What concerns my most, doctor, is the combination of the nasal hair, so around the airway, hoarse voice and stridor, which strongly suggests an evolving inhalation injury. I'm worried his airway could close for complete within the next few minutes, so I consider this a time critical condition, doctor.
Alright, thank you. That was a complete report. I'm heading to the emergency room now. In the meantime, please prepare intubation equipment at the bedside immediately. This sounds like early elective intubation is needed before the airway closes further. Send blood for carboxyhemoglobin and arterial blood gas. Continue the Rangers lactate infusion according to the Parkland formula based on 25% total body surface area burn. Insert a urinary catheter to monitor hourly urine output and keep him kneel by mouth.
My recommendation, doctor, is that you come to the ER immediately for further airway evaluation. May I prepare early intubation equipment at the bedside, given the seeing of impending airway obstruction. So also send blood for carbohemology level. And are there any instructions regarding fluid restitution? Target, give his burn percent. Please advise doctor. Okay, I understand, doctor. Let me repeat the instruction. Let me repeat the instruction back, doctor. Prepare intubation equipment at the bedside for early intubation. Send blood for carbohemoglobin and arterial blood gas. Continue regional lecture for the Parkland formula for 25% total body surface area burn. Insert a urinary catheter for hearted urine output monitoring and keep the patient ill by month. Is that correct, doctor? Okay. Understand, doctor. We'll be waiting in the ER. Thank you, doctor.
Yes, That's correct. I'm on my way to the ER now, about 5 minutes out. Okay, you're welcome.